Hello, everyone. I hope you're all keeping well today. My name is Lorraine Lindsay, here from Zero Health, to talk to you for a few minutes about mental health stigma in the workplace and how we can help reduce this with a few strategies. The World Health Organization has stated that 1 in 5 of us will experience a mental health condition or issue in any given year. The chances are yourself or someone you know at work may be experiencing a mental health challenge at present. And one of the main reasons for reluctancy to talk about mental health issues at work is stigma. Stigma refers to society's disapproval or society placing shame upon individuals who have mental health issues or conditions. And naturally, one of the consequences of stigma is shame and humiliation, and this can deter employees seeking support from their colleagues or from their employer for fear that they might be judged or for fear of negative career prospects. Furthermore, employees who experience mental health stigma in the workplace are more likely to have higher rates of absenteeism and lower rates of productivity. Therefore, challenging mental health stigma takes education, it takes understanding, and it takes changing our narrative around mental health issues. So now I'll provide you with 3 tips to help reduce mental health stigma in your workplace. The first tip is around language. So language around mental health is so important and can show that we are open and accepting of mental health challenges. So some language to be aware of, and I'll discuss in a moment, that can actually stigmatize mental health further is using statements such as describing someone's behavior as OCD, for example. She is very OCD today. Everything is very organized. Or he is very bipolar today. 1 minute he is up, next minute my colleague is down. Or describing somebody's behavior as crazy or nutty. And these might be common statements or words that we've heard before. Maybe we've even used them before without any malice. But for somebody experiencing a mental health challenge in the workforce, this can be seen as quite demeaning and quite isolating and can deter them further from opening up and seeking support from their colleagues or employer if they need. The second tip then, or strategy, is around education and training for employees and for management members. Stigma is fueled by myths and by false information. So understanding mental health conditions and the recovery process can help dispel these myths. And it can also help provide a psychologically safe environment for employees with mental health challenges. So that's providing staff with the tools to understand mental health conditions, to understand how to communicate with staff experiencing mental health challenges as well, and understanding their boundaries in that. Then finally, the last tip or strategy is cultivating an environment where there's psychological safety. So opening up conversations about mental health, regular conversations about mental health within the workforce. So this shows employees that the company is comfortable talking about mental health, that it's promoting positive attitudes towards mental health. And employees are more likely to open up and discuss any mental health challenges they have and seek support from their employer if they see this going on in the workplace. Now, this might look like checking in with employees in staff meetings, see how they're feeling, how they're doing, how they're managing their workload, promoting a work-life balance, promoting adequate breaks for employees to recover from work. And this might also be management linking in with employees and explicitly stating that if employees are having mental health challenges, to seek support from their management if needed. And then finally, listening to employees as well, having effective communication skills to listen and also to redirect employees to mental health services that are available by your company, such as EAP services, if that is something that your company provides. Thank you for listening to the strategies to help reduce stigma in the workplace. I hope they were helpful for you.